Food is love, and feeding is care. When illness takes away the spoon, a simple tube becomes the thread that ties hope and nourishment together. Let's make this simple. After hospital discharge, tube feeding may feel overwhelming, but every caregiver can do it, step by step.
Sister, Appa hasn't eaten. They told me to feed him through this tube, but I forgot. I feel so lost. That's okay. You're not alone. I'll show you, and then you'll try while I'm here with you. Ready? Yes? First, wash your hands. Keep things ready. Syringe, cool boiled water, feed, and a towel. Make sure Appa is sitting propped up 30-degree or 45-degree angle to avoid the food or liquid entering the lungs can cause choking, breathing problems, or even infection like pneumonia. We call this aspiration. Check the tube gently for stomach placement. Pinch the tube, open the cap, and attach the syringe to the tube and withdraw the contents of the stomach. If the aspirate is more than 50 milliliters, or if it is undigested, do not feed. Flush the tube with little water. Instill 30 milliliters water into the syringe and release the pinch. Let the water flow through the tube into the stomach. Pinch the tube before the water completely runs out to avoid the air entry. Give the feed 200 milliliters at most, slowly by gravity. Now fill the syringe with the feed by adjusting the height of the NG tube. If medications are to be given, powder them beforehand and give them diluted in water. Pinch the tube before the feed run out. Flush again with water to keep the tube clear. Never forget to close the tube. And always watch for discomfort, like coughing and bloating. If the tube gets accidentally pulled out, do not try to reinsert it yourself. Call me. After feeding, keep the patients upright for at least 30 minutes. Also remember, the daily feed requirement is calculated as 30 milliliters for every kilogram of body weight per day, using feeds that provide 1 kilocalorie per milliliter. For example, Appa weighs 72 kilograms, so his total daily requirement is 72 times 30 equals 2,160 milliliters per day. This total amount is divided evenly. For instance, 200 milliliters of feed every 2 hours from 6 a.m. to 10 p.m. Perfect mirror. Clean hands, calm mind, steady pace. That's all you need. I understood the steps, but what do I feed him? Simple foods from home, smooth dal soup, ragi porridge, vegetable soup, fruit purees, or milk with protein. Just make them lump-free, strain well, and always prepare freshly.
Feeding through a tube may feel unfamiliar, but it is still love, still care. With patience and practice, you can keep your loved one nourished, safe, and comforted. You are not alone. Krishnaveni, a 78-year-old mother. Raji, her only daughter. A young widow, raising a college-going son, working every day, and now caring for her mother alone. Cancer of the food pipe, esophagus, took away Krishnaveni's ability to eat. First solid food, then soft. Then even water became impossible. The doctors placed a feeding tube into her small intestine.
Amma, what if I make a mistake? This tube, this is the only way you get food now. You carried my whole life, Raji. Now let me trust you with mine. Raji, today I will stand with you. Tomorrow you will stand on your own. Always feed Amma in this position, never flat. Now, place a towel below the tube to keep her clean and dry. Her bowel sounds are active. That's good. Now we check the tube. No redness, no leakage. Pour the feed, only what the doctor ordered, and let it flow by gravity. We never pour fast, we never force. The feed moves slowly through the tube. If it doesn't flow, we use the plunger very gently. We never push hard. When the feed is over, we flush with clean water. This keeps the tube from getting blocked. While flushing, pinch the tube lightly so air doesn't go in. Now we clamp the tube, remove the towel, and make Amma comfortable. Now, Raji, your turn. Sits her mother up, places the towel, connects the syringe, pours feed slowly, flushes with water, clamps. Her hands are steady now. You've done it perfectly. Now you can feed her, even when I'm not here. Any problem? Pain? Leaking? Vomiting? You call me. I didn't want surgery because I didn't want to trouble you. But today, I feel lighter seeing you do this. You didn't give me life to live without you, Amma. Let me feed you. This is not a burden.
Sometimes instead of a jejunostomy tube, doctors place a tube directly into the stomach for some patients for different conditions. This is called PEG, percutaneous endoscopic gastrostomy. The purpose is the same, to give food, water, and medicines safely when a person cannot eat by mouth. For caregivers at home, PEG feeding and FJ feeding are almost the same. Sit the patient up, keep the tube and skin clean, give only prescribed liquid feeds, let the feed flow slowly, flush with clean water after every feed, clamp the tube and keep the patient comfortable. With good teaching, even simple caregivers can do PG or FJ feeding safely at home and protect their loved one from hunger, dehydration, and repeated hospital visits. Feeding through a PAG and FJ tube may look scary at first, but in loving hands it becomes a lifeline, a way to give strength, comfort, and love.